Good afternoon, viewers. You're welcome to another episode of Monitor Your Health, the program where we enlighten the public on health issues that are of concern. Thank you for joining us today. Today, we have important topic that we want to talk about. And I have two guests in-house. I have a psychiatrist and I have a psychologist. Yes, it's that big that we have to bring the two of them together. So we'll be talking about, panic. Panic and anxiety. We know that there are a lot of things going on in our world these days, especially in this era of COVID-19. A lot of people are worried. Some people will not even leave their houses. A lot of things happen. Some businesses are closing down. People are losing their jobs. There's so many, a lot of things, not only in Nigeria, even around the globe. We thought it would be important for us to bring, specialists to talk to them about the impact of this on our life, on our health. So if you join me to welcome Pastor Emmanuel Olajitan, a pastor, but today we want to tap to his expertise around psychology. You're welcome, sir.
Thank you so much, Dr. Femi. Thank you for having me on this program. Thank you.
You're very much welcome, sir. Can you introduce yourself? And then I go to the...
All right, my name is Emmanuel Olajitan. I'm presently the resident pastor of the Elevation Church Greater Lekki Center. Also a leadership development coach and psychologist, and also a counselor. So that's me in a nutshell.
All right, thank you so much. It's a pleasure to have you here. Now we go to the psychiatrist, Dr. Koyejo. You're welcome. Please, may we know you?
Thank you, Red. My name is I'm Dr. Jumoke Koyejo. I'm a consultant psychiatrist and an international certified addiction professional. I work in Federal Neuropsychiatric Hospital, Yaba, Lagos. Thank you very much.
Thank you. So now, panic, anxiety. We know that as human, when we see things, if something comes to us, suddenly, there's certain things that can happen to us. We either face it head on and fight it, or we run, or we might decide to just bottle up and then we're anxious and panicking about it. So today we want to talk about it. Please, what does it mean to actually, what is panic? What is anxiety? Can I direct that let me direct it to Pastor Emmanuel. Can you help us to start this?
All right, thank you so much. So basically, panic is our reaction to issues that we feel we are not prepared for. Yeah.
Right.
The issues that we feel may cause us harm, uncertainty, losing control, feel helpless, we have apprehension. So panic basically is our internal button that we press when we perceive these things in the course of living our lives. So right. It's basically a mental state. Let me, yeah.
All right. Okay. Thank you so much. So panic,
feel helpless. We have apprehension. So panic basically is our internal button that we press when we perceive these things in the course of living our lives.
Right.
So right. It's basically a mental state.
Brilliant.
Let me, yeah.
Thank you so much.
All right. Okay. Thank you so much. So panic, feel helpless. We have apprehension.
Sorry.
So panic basically is our internal button.
This is my
that we press when we perceive these things in the course of living.
All right, that's fine. So thank you so much. I think my computer just picked it from there and started picking what you're saying. So, right. So panic is an internal control when we're faced with things that is of concern. Does that match the way you look at it from the medical point of view, Dr. Koyejo?
Well, it's just maybe I have a few things to add. It's simply almost the same thing. I would want to see panic the same way, and also to a layman, I would want to explain panic or fear as putting your body in the overdrive mode. And it's, the way you put your car in overdrive, so hyperarousal. It's the emotion induced when the brain perceives a real or phantom danger or threats. It leads to physiological changes in the body, which is a fight or flight mode, and eventually behavioral changes. And these are the things that the pastor is trying to talk about, as in fleeing, hiding, freezing, and all those things. So, and these are actually a coping skill that is meant to be for a transient time. Of course, when it gets prolonged, it becomes a disorder. So, fear, panic, anxiety can be initially something good and to help us get out of danger through our flight or fight response.
Right. Okay. So it's a coping mechanism. That's what I'm getting from the two lines of explanation. So why is it important? If it's a coping mechanism, why do we call it an anxiety? Why do we call it panic? It should probably, by definition, if you look at when I hear something, I panic about it. It means like, it's already like a state of something that is not right, really. That's the way it sounds from the lay point of view. But why do we tag it as something really bad?
Okay, should I take that up?
Yes, please. I threw that open because I don't know who to direct.
Okay.
Okay. Dr. Jumoke is seeking to say something about it, but let me quickly say this. Panic is, like she said earlier, that at the stage of panic, it is positive. Why? Because panic can help us escape danger. Panic can spur us to take action. Panic can spur us to get into the groove, into the grind of what we are supposed to do. However, when we stay in that state of panicking for a longer period, it begins to tell on our physiological states. We become touchy. Some people begin to experience insomnia. So all manner of issues begin to come out of consistently staying in the mode of panic. Panic is good. It's like when you want to start a car. Your car starts with gear 1, right? But you don't drive the car on gear 1. That's how panic is. It is meant to be a starter, but you don't drive your life on panic.
Right. Okay. So it's a good thing, but it's got a bad aspect of it. But the initial phase, when we face it, just like what I gather from what Dr. Koyejo just said and what you just said now is, it is good. It's something that innately we need to carry on our normal life one way or the other.
Yeah, to function. Yeah.
It shouldn't be persistent. Now, the issue now is when we look at our world. I will take example. These days, COVID-19. People hear the word COVID. I've had so many people that tell, oh, we're doing this thing, can we come? We're doing this thing, can we do this? And people are like, COVID is here. We know that COVID has come to ravage our world and probably change a lot of things. And the reason why it's changing it is about what we're talking about here. So why is it this insult, which is the COVID-19, for instance, is here to stay? It's been here for going to be 6 months now. When we say that this is supposed to be gear 1, I think we're on gear 4 already, and we're still panicking. Well, so we continue to panic. So we still continue to panic about this particular thing. What advice or what do people need to know in terms of their physiology, in terms of their body, in terms of what they should be doing? The fact that this insult is here and is consistently here. Do I throw that to Dr. Koyejo?
Okay, thank you very much. Well, the first thing I would like to tell the viewers is that COVID-19 is a long-term thing. So we can't consistently put our gear in overdrive. Well, maybe we should even talk about people that this COVID-19 would affect most. Maybe, private businesses and schools and people that are in private practice would be, because government would still pushing the staff, people that work with government will still have some cushion effect. But the people in private practice, it's going to have a lot of effect on them. And the point now is, it has come to stay. It's over 6 months. It's becoming persistent. So like you said, it might be the new normal, which we'll have to adjust our body system to. So the first thing I would say to people is that, look, we really have to watch our body system and be able to deal with those phantom fear that we have. If you're becoming unnecessarily irritable, annoyed at the slightest instance, you might be getting anxious, and if you're getting sensitive to noise, becoming restless, poor concentration, you can't sleep, you're having less sleep hours. These are things that you should think of, I've put myself in overdrive mode. Other things that I could experience is discomfort in the chest, awareness of breathing, difficulty breathing, then headache, muscle aches, and dizziness. These are things that we should look out for. And if you consistently put your car in overdrive, I'm not an engineer, I might not be able to tell you that, but I'm sure there'll be something wrong if you put it in overdrive. However, if you put your own system in overdrive, what happens? Your immune system, it weakens your immune system. That's why when you say you are stressed, you have catarrh, because there is something is affecting your immune system. And that panic mode affects the endocrine system of the body. So it's the body system secretes some hormones to help us, because we put, it's like you are seeing a lion and your body system wants to help you how to get out of it. When you are seeing a lion and there's a fence as high as 10 feet, you'll be shocked that you would scale that fence, something that you would not do ordinarily. So that means the body is putting so much effort. And if this consistently happens, there is problem. And the next thing is, what should we do? For me, it's education. We should educate, like Monitor Health is doing, educating the public. There should be more education to the people, more education on prevention of COVID-19, more education about how the transmission of these things, so that people don't unnecessarily put themselves in overdrive. Education on your business. How else do I do this business? I'm sure it cannot be over. I'm sure there's always a way out of it, except we don't seek knowledge. And seeking knowledge is very important now. Seeking knowledge should be like self-help. Seeking knowledge is something like, okay, I want to learn more. How else do I do this? If you sell food in your house now, and you expect people to come to your shop, now it's not. You might have to be taken into where those people are. So seeking knowledge is very, very important. And there's something we don't do in Nigeria: relaxation. Our relaxation is party, owambe, and there are no parties anymore. So we should learn to relax in our homes. We should learn to relax in our neighborhoods. We should, it's a new normal. So there should be a new culture in us. How do we do it? How do you learn relaxation? I told someone at the time that I want to learn how to play. And the person laughed at me. I'm telling you, Nigerians need to learn how to play. I'm sure it sounds, you might even have to pay as an adult to learn how to play, how to relax, because there is a new normal. You've lived for 50 years. Now there's something new in the world. You have to change your culture entirely. And sometimes I like to tell people, when you tell people that you want to go and see a psychologist, people would rather see pastor. Thank God our pastor is a pastor cum psychologist. So it fits perfectly into this jigsaw puzzle. He said, what did you say, Pastor?
No, I said thank you. It's a compliment.
Yeah, because but some pastors are not psychologists. So sometimes I need to say a psychologist to talk. Someone that's skilled to help you get out of this. I can't overemphasize seeking knowledge. I can't ever overemphasize education. There was, there are several webinars around that there was one I watched with this business school, and we're teaching people that look, you have to re-engineer, redirect your business goal because there's a new normal. And these are the things we should look into. Because if you consistently put yourself in overdrive, there's something called anxiety disorder. And at that level, you'll be seeing Dr. Koyejo, a psychiatrist. There's something called obsessive compulsive disorder. There's something called panic attack. These are diseases that you would have to see Dr. Koyejo about, because I'm a psychiatrist. Then you start taking medication. So before you get to see Dr. Koyejo, why do you have to stay? Why do you have to keep thinking? Why can't you prevent it? Why don't go and learn how to play? Why don't you go and learn how to relax? These are things that we should look into, and it will really help us in this COVID-19 era.
Yeah.
Thank you so
Thank you.
much. Thank you.
Yeah.
So we've heard quite, Dr. Koyejo, I think when you move, there's something making some squeaky noise. Maybe it's something that is scratching on the table or something. So now, thank you so much for that explanation. And I think you've said quite a lot of things in that. What I want to know is, from the psychology point of view, how does this anxiety, how does it actually affect, the individual? Now we're still coming back to touch on some of the things that Dr. Koyejo has talked about, like in terms of the actual diagnosis. How do we treat it? What are the people from psychology point of view? How do you see this anxiety and or panic generally? Because a lot of people, like you mentioned now, people find it challenging to go through life challenges. The next thing is they will come to the pastor. But fortunately, we have a pastor and who is also a psychologist. So I'm just thinking, how do we see this in holistically, basically?
Okay.
Yeah.
So from the point of view of a psychologist, I think we don't start from doing. Because when you want to start saying, what should I do? You will get into a state of frenzy. And then you get into frenzy, you become agitated, panic sets in, and then anxiety follows, and then it goes on and on and on. The first thing to consider is the kind of person you should be in the midst of the crisis. What kind of attitude you have? What should be your disposition to the current situation? I call them B attitudes. B attitudes. That is the attitude that you should have in order to engage. See, there is no point jumping out there when you are broken, battered, beaten on the inside. You will become damaged. You will become damaged going out there, and not only that, you will damage people also in the process. You will wreak havoc. You will wreak havoc. So it is an internal journey. It's about, how do I perceive what is going on? What is my interpretation of what is going on? What is my interpretation of this disruption? Am I seeing it as a calamity or opportunity? Am I seeing it as a disaster or the opportunity to restart? You see, our frame of mind is very key. It's very important. In fact, in cognitive behavioral psychology, it's known that our perception determines our reaction. The way I perceive, let me give a practical example. A few days ago, this particular window behind me was open, and then it was raining. And so immediately, so it was middle of the night, so rain had poured into on my table, my books around me and everything. So I woke up, I had to move everything out, dry them up. Now, that was a disruption, right? But when I moved everything out, later in the day, I was going to arrange everything back the same way it was before. But I just stopped. I said, wow, this is a disruption. This is an opportunity for me to rearrange. Why should I let things go back to the same way they were before? So I had to now do some rearrangements, clean up some things, move some things out, move some things in, and it's looking a whole different. So our interpretation of what is going on around us is very, very important. You see, it's not about the issues that we have now, because some of these issues are not new. People have been losing jobs. Businesses have been failing. You know what I'm saying? Families have been affected. People have lost so many things. Yes, I'm not taking away from the fact that the pandemic contributed to it, but I don't. It's like saying, because this is happening, and this is what is going to happen to me. So we should look at the positive side of things, because if you don't look at the positive side of things, you will not be able to come up with solutions, ideas, innovations. There will be no adaptive strategies for you to navigate the present scenario. And that is very, very important. So it is who you should be, how you should perceive the world scenario, the world crisis, as it were, before you now step out there to begin to engage practically with some actions.
Right. So what's the implication of our environment with this, in the middle of all this? The environments, by environment, I mean the people, other things that, we interact with, because those are things that always, they're also here to stay with us anyway. Can they be like a tool, or can they be another form of disruption? Your video seems not to be working. I don't know why, but it's okay.
Okay, let me try and engage it, because I saw that it's still, but I'm wondering why. Maybe it's the network.
Yes.
Can I pick up and put it on again?
Okay, yeah, that's it. It's better. Yeah.
All right.
So yes. What's the contribution of our environment to this, based on what you're saying now? Because what you've told us so far, which is really enlightening, is, I like the word, the interpretation. How do I interpret the situation I'm finding myself? Okay. The interpretation will determine where I'm going to take, or the next step I'm going to take. But for me to be able to interpret the situation itself, sometimes it might mean like I need to juggle everything that is involved, whether within, around, or so which means that my environment will be part of it. So how does it match with everything?
Okay, thank you for that question. So let me quickly say this. It is wisdom in this season to be able to differentiate between what you have control over and what you don't have control over. See, you don't have control over everything. Now, being worried or bothered about what you don't have control over is pushing yourself into overdrive, serious overdrive, because there is no amount of worry that can make the government lift a ban on some things today. So it's outside of your control. Wisdom demands that, say, I have control over 1, 2, 3, 4, 5 things. These ones, I don't have control over them. So the ones I have control over, how do I maximize my control over them? Like we always say, we may not be able to direct the direction of the wind. We may not have control over the direction of the wind, but I have control over my sail. I can adjust my sail so that the wind can blow me towards my direction. The wind may be adverse, as it were, but because I can control my sail, so the wind pushes me with my adjusted sail to still get to my destination. Of course, there could be some delays. Of course, there could be some things that I could have. There might be some rockiness, some shaking here and there. But at the same time, because I am set on a direction and I've adjusted my sail, the wind that is meant to be a disruption now becomes an assistance to push me in the direction of my goal, in the direction of my purpose.
Okay, thank you so much for that. So, Dr. Koyejo, I mean, all this being said, we know that, you know, we can drive ourselves in that overdrive mode that you said. We cannot sustain this. And you've said a lot of things about how panic can then result into physical, you know, problem, because it's initially psychological, now it's driving people into physical. What can one do innately or based on the environment as well that can actually influence, you know, this clinical presentation that can then, you know, arrive from this? And let's start from, you talk about obsessive compulsive, you know, disorder earlier on. What are the other conditions that this can actually drive us into if we persistently remain in that overdrive? When we do that, then we'll talk about the second question.
Okay, well, let me answer what this overdrive could drive us into. For people that have experienced chronic adverse childhood, that have had adverse childhood experiences, people that are genetically predisposed, that means they have family history of anxiety, people that have personality that are easy warriors. This will just, because they are at risk already, it tips them into illness. Okay, imagine someone that had traits of obsession before, that the bed has to be laid in this particular way. I have to wash my hands in this particular way. Now there's the problem that's telling you to even wash your hands more. So definitely it just push you to do it more and more. And lately, even in the clinic, we are seeing people with obsessive compulsive disorders because it is now having so much impairment on their person, on their career, on their relationship, and so many other things. Apart from this, because of the bodily changes that would happen with anxiety that goes with this COVID-19, people could develop hypertensive diseases because of the missed beats, increased heart rate that stays for a long period of time. I've told you that there will be decrease in people's immunity. So when you have a knowledge of this, now we're talking about your perception of, the pastor talked about the perception of the illness. I'm telling you that look, if you have a wrong perception, it leads to these bodily changes, and it will lead you to other physical diseases. Why not find a way out? And it's talked about even your perception, you're educating yourself, seeking help, seeking knowledge. It's an important thing we all have to do at this point in time. Seeking health and knowledge, education and knowledge about even your relationships. How do I keep in touch with Dr. Ogunremi? How do I keep in touch with Pastor Emmanuel? Now I know that I don't have to burn my unit anymore. I could, you know, how do I keep up? Then my health. I know that if I continue in this overdrive mode, I could have physical illnesses. Like I've told you, relaxation is something that is very important. If I continue in this, how does it affect my career? So like I've said, our perception, and our perception can only be influenced, we can perceive it well if we have knowledge. Knowledge as a way of determining our perception. Now there is a problem. What knowledge do I? Okay, now I know that I can do my business in this other way. So it changes my perception. You can use the wind and wind vane, that wind to generate electricity. And the wind can blow houses away. It's the same wind. So some people can make use of that same wind to give themselves electricity. And some people can even build houses along the wind line, and it will blow those houses away. So for like the pastor said, which I accept totally, our perception. But what governs, what engineers our perception is the knowledge you have. Why are we on Zoom and Facebook today? Is the knowledge you have that we can do this to help people. those are the type of things we should work on. And like I said, if you know you have a personality that they easily get worried, then this is the time to calm down. This is time to look inwards. How do I help myself? You've had adverse childhood experiences. You're genetically predisposed. You have family history of anxiety disorder. Then you really have to sit down and think about it. How do I help myself at this point in time? Something, relaxation. It's very important. If it needs you to pay money to learn how to play, how to relax, I guess you might just go online and learn those basic things so that you don't continually be in that overdrive mode and you don't get into physical illnesses because of this COVID-19. It is not just you. It is the moon is crashing, or the sky is crashing. It's crashing on everybody, not just you. So that's how we should see this.
Thank you so much. So there's something I want to bring out there, like at what stage will an individual who, I mean, of course, we all panic about one thing or the other, and it happens, it goes, it happens, it goes. At what stage do people, or what are the telltale signs that people see it and say, wow, this is not normal again? I'm moving out of the normal, drive now into an overdrive state. What do people need to take, cognizance of?
Okay.
Yeah.
Well, from the overdrive into a disorder now. You've been from the overdrive into a disorder, from the overdrive into your car breaking down. Okay. Well, for me to diagnose a disorder, there has to be impairment in social life, in relationship. There has to be impairment in functionality. Functionality, your relationship, your career, and your health. What are those things that you would see that you know that, wow, I can't function anymore? Continue, have a headache, fearful anticipation of everything around you, as if COVID is right by your door. You're getting irritable, you're sensitive to noise, you're restless, you have poor concentration, poor memory. Sometimes you don't know where you left this, you can't learn new things. Sleep disturbances, these are things that when you see those things, you know that, look, I guess this overdrive, and it's beginning to have impairment one way or the other on your functionality, then this overdrive is getting to a disorder. I won't diagnose a disorder for several months, maybe like 6 months before I can say, okay, there is anxiety disorder, there is panic attack in this patient. When they're having difficulty, chest pain, difficulty in healing, continuous body weakness, these are the type of things that are like, okay, wow, there is an impairment and it's affecting your functionality. Then I would say over a period of 6 months, I'll tell you there is a disorder. Then you need to see a psychiatrist and of course a psychologist also to help treat. But why not prevent if you can, if it is preventable?
Okay, thank you so much. That means you have a lot of job in your hand in another month or two.
Yeah.
We're 4 months in Nigeria into it now. So by the time we have 2 months, then you have a lot of job in your hand. So anyway, thank you so much for that. Now, you actually led us into something that I really want us to talk about. You talk about the fact that now your car is broken down. The car needs fixing. Okay. When we say car, we mean, you as an individual, you put yourself in an overdrive. You've been going, now the car can't go again. So you're broken down. You now have anxiety, full-blown anxiety disorder, and this needs fixing. Now, I know there's a balance between a psychologist and a psychiatrist, and your position is clear. I want to start from Pastor Emmanuel. What will psychologists do to support or to help patients? And at what stage will you then say, look, this is now more than a psychological, maybe talking therapy. Now you need to go and see a psychiatrist. I know it's usually a balance between the two of you. One is sending to the other and sending back and forth. How does it work?
Okay, thank you, Dr.
Oh, internet.
I can't hear him.
Oh, okay.
Okay, we can't hear you now. Okay.
Okay.
All right. So, Dr. Koyejo. Hello?
Hello?
Your internet is
Hello.
Your internet is playing up now. Okay. Okay, we can. I think he's back.
Hello. Can you hear me now?
Hello. Yeah, I can hear you now.
Yes, I can hear you. Yeah.
Oh, okay. Apologies for that. So, like I was saying, what a psychologist will do or should do in the first contact is to first of all hear the person out. What are your fears? Yeah, what are your fears? Allow the person to pour out everything that looks like they could be family, it could be business, what all the stuff that are a source of concern. Now, after that, you now want to look at what are the triggers of panic. We call them the triggers for this panic. Now, we now look at the triggers and we're like, you know what? Can we give you a different frame for interpretation of these triggers? Can we give you a different frame of mind? So the different frame of mind now helps you see these things in a new light. So instead of seeing this whole situation as bleak, as dark, as overwhelming, with a new frame of mind, you're able to see, like we say, light at the end of a dark tunnel. You can now begin to have a different interpretation to what is going on. You are now beginning to see that it is not all dark and gloomy like you saw it earlier. You're beginning to see new opportunities. You're beginning to see you are beginning to see that it's actually an opportunity for you to see things differently and do things differently. So that is what a psychologist will do at the initial stage to get you into a different frame of mind, because you can't do anything differently from your perception. Your perception determines your interpretation determines your preparation, and then your preparation determines your production at the end of the day.
Right. Thank you so much.
If I can't get you to have a different interpretation, there is nothing you bring out there that will actually be worth anything. It will all be mad. You'll be so disillusioned. You'll be overwhelmed. You'll be actually disoriented. So it is when all this has been done, and the person is still saying, you know what, Pastor, I'm not getting myself. I'm not even understanding you. Hey, you now know that this one is there is something else behind it. And after you do your way, so you want to pass the person across to a psychiatrist to begin to look, okay, maybe there is something else that needs to be addressed. Maybe some medications need to be prescribed or some other therapy needs to be prescribed, So that is where it comes in. But basically for a psychologist, it's about traveling with the person on the inside.
Right.
It's an internal. Yeah.
Right. Thank you so much. So viewers, if I'm getting it right, I'll clear here. So what's the psychologist is telling us is that there are stages. So if you have issues, you're worried, you think this is getting out of control, like Dr. Koyejo has said earlier on, this is persistent, and obviously you are in overdrive mode and now you can't function. There's an impairment. An impairment means that something is distorted. You are not normal in your normal daily activities, affecting your function now. at that point in time, you need help. So you might need to talk to a psychologist. And that's why, we've had this discussion or this talk around things that can be done from the psychology point of view. They're talking therapists. They will explore your mind. There's no point going to a psychologist if you don't want to talk, because that's what they do. You just have to be able to open up and talk and outpour your mind. And then from there, they might look at the windows of opportunities there for you and see whether this window that you think is shut and closed, based on everything that you've discussed with them, then they can find another way and say, this route is better. And then let's explore that route. I know there are other things that can also be done from the physical point of view, which I'm going to ask our, psychologists. There are questions coming up from the public. I have about 3 or 4 questions here, but let's answer this and we'll go into the question and answer. So from the psychiatrist's point of view, somebody obviously is not functioning now. This is gone on for about 6 months. Is worried, is someone worried, possibly he had seen a psychologist that tried to explore their mind to see whether the alternative way of handling things, there's no way out. How do you help these people?
Yeah, thank you very much. Well, I would definitely tell people that it's not just the psychological things that could cause people to have anxiety symptoms. There are some physical illnesses, and it would rather be better for us to rule out, okay, there are no physical illnesses, and we direct you to a psychologist, because those physical illnesses could, if they are not treated, the psychological intervention may not work. So
something is making a squeaky noise when you're talking.
Oh, okay. I can't.
Yeah.
Okay.
It's not your headphone.
Okay.
The noise is quite loud. Yeah.
It's still loud now. Okay.
No.
Should I continue or should I repeat myself?
Yeah. Please continue. We're enjoying you.
Okay. So those anxiety symptoms we have mentioned, there are several other physical illnesses that could cause them. And no matter, I would rather want you to, so that we rule out those physical illnesses. If the cause of these anxiety symptoms are physical illnesses, we rule those physical illnesses out. If they are there, then we treat, we still send to a psychologist. If they are not there, fine, then you go to a psychologist to continue the treatment. So in the assessment period, we really need to rule out any other biological symptoms that are possible for it to be treated. And let me tell us that even those anxiety symptoms, there are other illnesses that could occur with it. In depression, there could be depression, there could be panic attacks in places where people feel that they are going to die right now and they can't just control themselves. So, of course, medication is basically what we use to treat them. After we ruled out the biology, the physical illnesses that might cause those anxiety symptoms, if they are not there, then there are medications that are used to treat anxiety. We will always work with a psychologist. That is basic, because psychological treatment with medication works best for people that have anxiety disorder. That means people that don't have underlying physiological comorbidity, co-occurring physical illnesses. They must always see a psychologist who would co-manage these patients, the clients.
Thank you so much. I mean, there have been a lot of information, that's been, released here now. Now, there are, let's answer maybe a couple of these questions, and then I will be rounding up for the day. So somebody said that, can CBT work for panic or anxiety? So I'll throw that to Pastor Emmanuel, please.
All right.
Okay.
Yes.
Yeah.
Yes, it can. If the person is willing, because really, as a psychologist, you can't help people who are not willing to be helped. That is very, very important. See, there has to be that connection. There has to that is why when it comes to, consulting with somebody or having a time with somebody you are talking to, when it comes to psychological interventions, you see that ability to connect with your psychologist and be able to open up, let him be able to travel into the window of your mind, travel down the journey with you, and then see things from your perspective, and then begin to draw out. In fact, the truth is this: for the psychologists believe that the answer is actually inherent in everyone, because sometimes, as a psychologist, I also add a bit of coaching into what I do, so everybody has the answer. So in my interaction, in my questioning, in my probing, I realize that this person actually has the answer on their inside. They just need somebody to probe and then to bring out the answers and bring out the solution. And the person's like, wow, I didn't see it that way. I never saw it in that light. I never saw it in that direction. So panic and anxiety can actually be handled with CBT. Yeah.
Thank you so much. So for the public, for those of you that will be asking, what is CBT? CBT is cognitive behavioral therapy, which it just simply means talking therapy. So whether you can be talked out of the anxiety state or the panic state is what this person is asking. And you can hear that if you are open to discussion, if you are not open to talking, because there are patients that will come, even personally I've had patients that will come to me and I realize that they're not ready to actually open up. They say that therapist is just useless. I don't even want to talk to them. And I just think, well, if you don't want to talk, how would they help? And from the medical point of view, there's limit to what you might be able to do to help these people. So for you to get help from the psychologist, you must be willing and be open to actually talk. Okay, thank you. So the other question comes in and it says, can antidepressants work for panic attack so that one won't go deep into depression? Dr. Koyejo.
Well, thank you very much. Well, there are some medications that are used for depression and as well as for anxiety disorders. And in my world, there's something we call the International Classification of Disease. Panic attacks and generalized and the phobias are under anxiety disorder. When I say anxiety disorder, I mean an umbrella thing, an umbrella body that covers all this list of illnesses, these disorders. Well, sometimes people that have anxiety disorders could have a co-occurring depression. Sometimes there are symptoms that look mixed anxiety depression. And the whole essence is there are medications that are meant to treat depression and are used for anxiety disorders too. So it's left for you when you get to see the clinician. The clinician determines what medication he or she would give the person depending on the presentation. Like I've said, some people, they have thyrotoxicosis and they have, of course, they're presenting with anxiety symptoms. The first thing might be to go and treat, to send to the endocrinologist to actually treat. And with that, you would see that the anxiety symptoms would go down. So I won't want us to just say, well, depressive, no. There should be a proper assessment. And I say proper assessment because other physical disorders could present with anxiety symptoms.
Thank you so much. So there are obviously things that can be used, but it's very important for you to be assessed. So if you think that you're getting yourself in this mode, we'll plead that you see a doctor or you speak to a doctor. Better still, I forgot to tell you about Area Doc that sponsored this program. You can actually download Area Doc app, and from there you can interact with the app or interact with a doctor who can then advise you on how to go about, situation. So don't leave it in your own. And when you call a doctor on Area Doc or you chat with them, it's free. You don't pay consultation. So take that as an advantage. Now, the next question is, what do you do when anxiety show up and you don't pay attention to it, staying in denial? So maybe I should let anybody can pick that, So people are in denial, but definitely, yes. Okay, Dr. Koyejo.
Yeah, you are in denial. So what do you do? If you want to do something, that means you're no more in denial. Then that means you accepted the problem. So it's not possible to be in denial. And what do you do? Like I've said.
So carry on. Carry on.
So when you have mild anxiety symptoms, like I've said, prevention is better than cure. By the time you have impairment in your functionality, they need to go for proper assessment. And like I've said, our perception, cognitive behavioral therapy. What does that mean? That is cognition, the way you think, affects the way you behave. And what affects the way you think and then the way you behave? Your knowledge. So why not seek knowledge? Why not learn how to calm down? These are the basic things you should do. But what do you do when you have anxiety disorder? See a doctor that would assess you to rule out those symptoms that there are no other medical illnesses. Then the doctor works co-manages the patient with the psychologist. Very important. There's no magic in this. As you're using your medication, you're seeing your psychologist. So that's what you do.
Yeah. Thank you. So we're getting to the end of this. So obviously, like Dr. Koyejo just said, if you're in denial and you know you're in denial, it means that you have insight. So you know what's going on now. That's a good thing on its own. But if it's a third party observing that this person is anxious or is in anxiety state, but he's not actually, doing things, I think then there's a bit of a problem in that case. The most important thing is try and see a doctor, let them assess, situation and see how to help you, or you talk to a psychologist and see how people can help you. Thank you so much, Pastor Emmanuel. Thank you so much, Dr. Koyejo. It's been an insightful evening. And then I want to thank you, viewers at home. Oh, maybe before we go, do you have any words you have maybe in 1 minute? Do you want to, are there encouraging words you want to give people just to round up the assembly? I'll start with Pastor Emmanuel. Yeah. Anything just to insight.
Just to round up. Say, having lived on the surface of the earth for over 5 decades now, by God's grace, I can tell you for free that life here on earth is complex, and you are not designed by your creator to live it out by yourself. You have been designed in such a way that makes you unique, and you are specially crafted for a purpose. You see, when purpose is known, your propensity to be anxious, to become panicky in some situations is reduced because you have a purpose. You are not what you are doing. You are not a bank. You are not, as it were, your profession does not define you. Your acquisition does not define you. So even if your profession is taken away, even when your acquisition, as it were, is taken away, you are still who you are because you have been called to fulfill a purpose. So the best thing for everyone to do is to identify with the creator, because it is the creator that defines the purpose of the products. So you are a product. So get to know your creator, identify purpose, work with your creator. And definitely, no matter what happens, you're on the safe lane. I think that is very important for every one of us to note.
Thank you so much, Dr. Koyejo. Any last, just summary, just advice to the public?
Yeah, thank you very much. Well, like the pastor said, spirituality might actually help, even scientifically. Another thing I would say is that self-help, by trying to seek knowledge, it's very important. And I keep talking about relaxation. It's very important. When you put your finger on the drive, you not change the gear back to normal drive and settle down with new normal. And if it doesn't work, seek further help with the medical practitioner. It's very important. And I know this COVID-19 is a new normal. In 5 years' time, we will deal with it and we will all be fine. And that's what I'll have to say to our viewers. Thank you very much.
Thank you so much. So, yeah, on that note, we will be rounding up. So, you've heard it all. Please take care of yourself. Try and, as much as possible, look inwardly, assess yourself, look at the situation around you. We talk about, tools that you can use, your family, exercise is very key, it's very important. And if you think that things are not going in the right way, you try and assess a doctor, assess a psychologist. More so, you can also, download Area Doc again, and then you can have free access to, to doctors that way. So on that note, I want to say thank you so much for being with us. We look forward to meeting you again next week, where we'll be talking about another topic, which based on whatever you have told, you've asked us from your comments or from the messages that we're getting from you. Bring another topic that will be very helpful. Thank you so much and have a great evening.